Two patients, Dave W. and Dave B., both show up in the emergency department with belly pain. However, neither of their exams reveals an obvious cause. Dr. Freeman is concerned that Dave W. may have an underlying illness. She orders an ultrasound which reveals a kidney stone. So Dave W. receives opioid pain medications to treat his pain. In the next room, Dr. Freeman believes that Dave B. is just drug-seeking, faking his pain to score opioids to get high on or maybe even sell on the street. She discharges Dave B. home without further testing. He ends up with a serious kidney infection. This difference in outcomes may be due to medical implicit bias, the unconscious attitudes that affect our decision-making. But how does this happen? Physicians spend years learning how to quickly recognize symptoms to allow for a quick diagnosis and treatment. But sometimes unconscious racial preferences influence their decision-making, with dangerous results. And worst of all, the foundation for these awful thought patterns begins in training. Let's trace back to when Dr. Freeman was just a medical student, agonizing over question banks with thousands of practice problems. When researchers at Rush University analyzed these questions, they found an alarming pattern. Black patients were depicted more negatively than white patients. In one question, a white mother is described to have a healthy, normal pregnancy, while a different question portrays a black mother who didn't attend appointments or take her prenatal vitamins. Sadly, question banks aren't just testing students' medical knowledge, they're unintentionally laying the tracks for implicit bias, with real-world ramifications. It's time to rethink the way we teach and learn medicine.
We are Project RBIMT, Removing Bias in Medical Training. Visit us online at rbimt.org.